Healthcare fraud, a Medicare scam. The DOJ calls it the largest ever, $14.6 billion in intended loss. On June 30th, 2025, in Washington, D.C., federal prosecutors charged 324 people tied to telehealth mills, bogus orders, and kickbacks. They weren't just gaming a system, they were billing you. One call, a 7-minute visit, and a brace or lab test you never asked for turns into a claim in your name. Today, we'll show how that phone call becomes a 5-figure bill, and how to spot it before money leaves the program. Here's the plain truth officials gave the country. This takedown is the largest in U.S. history, measured by the number of defendants and the money conspirators tried to pull from Medicare and Medicaid. Intended loss means the amount fraudsters sought, whether or not payers blocked part of it. Agents say they seized more than $245 million, cash, luxury cars, crypto, property, and estimate about $2.9 billion already left public programs before investigators could shut the spigot. The headline number shows scale. The second shows impact that lands on taxpayers and premiums right now. Nearly 100 of the people charged were licensed professionals, doctors, nurse practitioners, pharmacists, accused of turning trust into invoices. And within the sweep sits a transnational catheter-billing ring that, according to prosecutors, used stolen identities and straw-owned suppliers to push over $10 billion in fake claims, touching more than 1 million Americans. If this feels abstract, picture the letter an older American opens. An explanation of benefits, listing a brace or genetic test they never received, a provider they never met, a balance that makes no sense. That confusion is the point of these schemes. Move fast, bill big, and hope the patient never calls. If you believe your taxes and premiums shouldn't bankroll scams, don't just watch and scroll. Subscribe now so this reaches the next family before their name shows up on a bill, and so we can track these cases to the end. In this documentary, we stay with the facts, the filings, and the numbers you can verify. We'll break down the 3-step pipeline: lead gen, telehealth, orders, then show how money moves through shell marketing fees and why these networks keep coming back. For now, hold on to the date, June 30th, 2025. It marks the day the government drew a line and said, enough. Summer 2025. Federal agents said the pattern was the same in case after case. A call, a quick visit, an order, and a bill with your name on it. The Justice Department and HHS OIG described a national network where telehealth mills, durable medical equipment suppliers, and labs worked in sequence to generate claims tied to the June 30th, 2025 takedown. It often starts with lead generation, robocalls or online ads that capture seniors' details and push them toward a brief telehealth encounter. Prosecutors say some encounters were cursory or misrepresented, yet they produced standing orders for braces, catheters, genetic tests, or panels that could be billed nationwide. In the 2025 action, the government specifically flagged telemedicine and genetic testing schemes linked to over $1.17 billion in alleged false claims. From there, the order moves to a supplier or lab, sometimes a shell company set up or quietly acquired by organizers. The company submits claims to Medicare or other payers using standard procedure codes CPT/HCPCS. The pitch is clinical. The paperwork looks routine. The volume is not. Officials said the larger operation tied together hundreds of defendants using the same backbone: rapid ordering and mass billing on benefits intended for people who actually need the gear or tests. The money loop is where fraud shows its hand. Marketing fees and consulting payouts move between telemarketing outfits, purported clinics, and suppliers. In some districts, prosecutors described kickbacks masked as vendor contracts. In others, they said overseas organizers fronted U.S. supply companies. then routed proceeds through layered accounts. The headline figure, $14.6 billion in intended loss, captures what conspirators tried to extract across these pipelines, whether or not payers stopped part of it. The human impact shows up quietly, an explanation of benefits for a brace or test someone never received, or a provider name they've never heard. Authorities emphasized that this was not a handful of bad bills. It was a coordinated, multi-state model that DOJ calls the largest healthcare fraud takedown in its history, built on these repeatable steps. Hold on to the sequence as we move forward. Lead gen, arrow, telehealth, arrow, order, arrow, billing, arrow, payout. In June-July 2025, that chain is what connected telehealth mills, DME, and labs across dozens of districts to the same outcome, claims the government says never should have been submitted. Next, we'll ground that pipeline in real cases from the takedown to show where each step breaks the law. Start with the biggest shock. Prosecutors say a transnational network, based in Russia and elsewhere, used stolen American identities and straw owners to acquire U.S. medical supply companies, then pushed over $10 billion in phony urinary catheter claims to Medicare. Investigators say more than 1 million Americans were touched by this ring alone. It's part of the same crackdown you've heard. 324 people charged and $14.6 billion in alleged fraudulent claims across the country. Here's how that catheter case reads in the charging papers. The companies look legitimate on paper, the claims use real beneficiary data, and the volumes are extreme. Orders that don't match medical need, shipped or billed at a pace that says factory, not clinic. U.S. attorneys describe it as a multi-billion-dollar fraud and money laundering pipeline, routed through front companies and foreign handlers. Now widen the lens to telehealth and genetic testing, the backbone of many schemes in this sweep. Officials say 49 defendants were tied to about $1.17 billion in claims driven by brief telehealth encounters that generated standing orders for braces or tests most patients didn't ask for. The encounters felt like care. The paper trail read like mass production. You also see cases that don't look like billing at first glance. Drug diversion charged alongside insurance fraud. Federal partners say the takedown encompassed over 15 million pills of illegally diverted controlled substances. Scripts written or filled outside medical purpose. Pharmacies and intermediaries moving product while billing programs meant to protect the elderly and the disabled. Seizures across the action include more than $245 million in cash, vehicles, crypto, and property. Put the three together and you get the pattern we're tracking in this documentary. Stolen identities and shell suppliers driving staggering device claims. Telehealth used as a trigger for DME and lab orders at scale, and diversion cases where pills move one way and insurance money moves another. That's why the government calls this its largest healthcare fraud takedown. By people charged, by dollars attempted, and by reach. Next, we break down why this keeps happening, how incentives, code sets, and shell companies make the same playbook work in state after state, year after year. The playbook repeats because the incentives line up and the gaps are real. Federal officials say the 2025 takedown exposed the same spine across dozens of districts. Cheap lead generation, a quick telehealth touchpoint, high-margin orders for devices or tests, and mass billing into public programs. That model scales nationally, which is why the Justice Department and HHS OIG framed June 30th, 2025, as the largest coordinated healthcare fraud action in their history. 324 people charged, tied to $14.6 billion in alleged intended losses. Why it persists starts with volume. Codes for durable medical equipment and lab testing can be billed at scale, and older Americans are easy to reach by phone. Brief telehealth encounters create paperwork that looks legitimate, even when the medical need isn't. In this sweep alone, the government flagged telemedicine and genetic testing schemes linked to roughly $1.17 billion in claims, proof that once orders are scripted, the billing engine runs fast. The next reason, networks learn. Prosecutors say transnational groups bought or fronted U.S. supply companies, used stolen identities, and pushed extreme volumes, like the catheter ring tied to over $10 billion in alleged false Medicare claims that touched more than 1 million Americans. When one company name burns out, organizers can shift to a new shell and reopen the funnel. Kickbacks hide in the wash. Money labeled marketing or consulting moves between call centers, pop-up clinics, and suppliers. That's how a short call becomes a 5-figure claim and a downstream payment. DOJ's charging papers and agency summaries consistently point to disguised payments for referrals, a core reason these pipelines keep paying until they're shut down. There is a counterforce, and it's getting sharper. DOJ's healthcare fraud unit runs a data analytics team that flags outlier billing in real time. In the 2025 action, DOJ said proactive analytics helped detect anomalies and prevented billions from being paid before money left Medicare. HHSOIG and CMS are part of that front line. This is one reason officials stress that intended loss is the harm conspirators sought, even when analytics or edits block some payouts. On the civil side, the False Claims Act gives the government leverage to claw back money, treble damages and penalties, and to pressure corporate defendants into settlements and compliance fixes, even when criminal cases aren't filed. Pair that with administrative exclusions from federal programs, and the long-tail pressure mounts after the headlines fade. So the answer to why this keeps happening is simple and uncomfortable. The rewards are big, the tools to mimic real care are cheap, and the networks adapt fast. The response is evolving too. Data screens, faster interdictions, and civil recoveries layered on criminal cases. But the tug of war is ongoing. Next, we shift from mechanics to what you can do when an explanation of benefits lists care you never received, and where to report it so the money stops moving. Start with the paper. Your Medicare Summary Notice, MSN, or Explanation of Benefits, EOB, is not a bill. It's your scoreboard. It lists services or supplies billed in your name, what Medicare paid, and what you may owe. If you see a brace, catheter supplies, genetic test, or lab panel you never got, that's a red flag. Do 3 things: review, record, report. Review the line items. Record the details: provider name, date of service, claim number, and dollar amount. Then report it to the people who can act. First, call Medicare, 1-800-MEDICARE, 1-800-633-4227. Tell them you suspect fraud and read the items off your MSN/EOB. If you're on a Medicare Advantage or Part D plan, you can also contact the plan and the iMedic contractor at 1-8777-SAFRX, 1-87777-23379. Second, report to the HHSOIG hotline, the federal team that investigates healthcare fraud. You can submit online or by phone at 1-800-HHSTIPS, 1-800-447-8477. TTY users, 1-800-377-4950. If you prefer mail or fax, those channels exist too. Keep your notes handy. They'll ask for names, dates, and claim numbers. If you're helping an older parent or neighbor and want hands-on support, connect with your state's Senior Medicare Patrol, SMP. They teach beneficiaries how to prevent, detect, and report fraud, and they'll walk you through suspicious bills step by step. Find your local SMP through the National Resource Center. When you report, you're not just fixing one line on a statement. You're putting weight on the scale that stops the next claim. Investigators use these tips to map patterns and shut down pipelines just like the ones charged on June 30th, 2025. If you'd want someone to flag a fake claim under your name, pay it forward. Share this now and subscribe so this warning reaches the next family before the money leaves the program. After the June 30th, 2025 sweep, the cases don't end with a press conference. They move into arraignments, plea talks, motions, and trials, district by district, off the headlines and onto court calendars. Prosecutors say 324 people face criminal charges tied to $14.6 billion in intended losses, with about $2.9 billion in actual losses already borne by public programs and over $245 million seized. Sentencing will depend on the evidence, the counts, and the guidelines in each case. Some will plead, some will go to trial. Others will flip and cooperate. One marquee thread will keep unfolding: the transnational catheter network. Federal filings and major outlets describe a ring that used stolen identities and straw-owned suppliers to push over $10 billion in false Medicare claims, touching more than 1 million Americans. Expect superseding indictments, asset recovery actions, extradition efforts, and parallel civil suits as investigators follow the money across borders. Criminal charges are one lane. The False Claims Act is the other, and it's built for the long game. Under the FCA, defendants who caused false claims can owe triple the government's damages, plus per-claim penalties that are adjusted for inflation. That means even after the criminal dust settles, civil cases and settlements can keep clawing back money for years. Administratively, the government's hammer is exclusion. When HHS OIG excludes an individual or company, no federal healthcare program can pay for any item or service they furnish, order, or prescribe. Exclusion shuts off the reimbursement valve, Medicare, Medicaid, all of it, until that name is off the LEIE list. Expect exclusion actions to shadow criminal outcomes and civil resolutions. The government is also leaning harder on data. In response to this takedown, agencies touted expanded analytics, linking claims, banking, and licensing records to spot outlier billing and stop payments before they go out. That's part of why officials emphasize intended loss. It measures what conspirators tried to obtain, even when edits and analytics blocked millions midstream. So what should viewers expect? Rolling court updates across 50 federal districts and 12 state AG offices, plea deals from insiders, restitution orders, FCA settlements, program exclusions that keep repeat actors from billing again, and in big cases, years of asset tracing. We'll track the outcomes on the catheter ring, the Telehealth genetic testing cluster, about $1.17 billion charged, and diversion cases counted in the 15 million pill tally. If you believe programs funded by your taxes should protect patients, not bankroll scams, prove it. Subscribe so these case outcomes don't vanish into the algorithm, and share this with someone who reads their parents' EEOBs. Justice is slow. Community pressure is not. Next, we'll keep names and numbers tethered to public filings, criminal dockets, FCA complaints, and exclusion notices, so you can see exactly what's recovered, who's barred from billing, and where the money actually comes back. This wasn't a headline. It was a map of how money left programs built for care. June 30th, 2025 marked a line in the sand, but the real work is what happens next. Charges, exclusions, recoveries, and the names that won't be able to bill again. If you want taxpayer dollars to protect patients, not bankroll schemes, subscribe and turn on alerts. Share this with the person in your family who reads the EOBs. We'll follow every major case to sentencing and recovery, and we'll post updates when money comes back.